Thank you. So welcome everybody to this conference on medical aid in dying within a hospital environment. We have with us today Sophie Villemaire, who is the clinical nurse at the ALS clinic for the Centre Hospitalier de l'Université de Montréal, le CHUM. And we have Lisanne Desrosiers, who is the liaison nurse for organ donation for Transplant Quebec. I give the floor to you. Thank you very much.
Thank you so much. Again, I'm Sophie, I'm a nurse, and I'm working at the ALS clinic at the CHUM. Today we have a bit of a dark or heavy subject, but I will try to make it as light as possible. My goal is to give you information, and I would like for you to stop me as I go along. So if there is a few things you don't understand because my English is not perfect, or there's a few things that are not clear, please stop me and ask me the question as we go along, and I'll answer you. So the first thing, of course, is, as you know, ALS pushes us to take decisions, sometimes confronts us and makes things go faster than we really would like to. So there's a lot of important decisions that have to be taken. The one we're going to be talking today is about end of life. So there are choices, and you probably already know, like, there's palliative care that can be at home or at the hospital. It is also the palliative sedation, which is kind of putting yourself in a deep sleep with no pain, but we're not provoking, so we're not ending life. And today we're talking about medical assistance in dying, or medical aid in dying, which I might be saying MAID as we go along, so it's shorter for me to talk about it. So first of all, just a bit of history and legal changes that have occurred in the law. So what is it today in 2022 to have access to the medical aid in dying? So as in last year, in March 17th, there was a few change in the law. Of course, medical aid in dying has been around for 4 years now. It's been accessible for now 4 years, but there's a lot of things changed every year, and last year was major because there was a lot of things that make it, let's say, more accessible. So we'll go through all the criteria. First of all, the person has to be insured by the meaning of law, so by the RAMQ here in Quebec. Must be an adult and able to consent to the care. The criteria of end of life, so reasonably foreseeable natural death, that has been abolished. We'll have a bit more information just afterwards. The other criteria, which is suffering from a serious and incurable disease, has been modified. So it is a serious and incurable disease, illness, disability. Everything within the mental illness, so cognitive problems and, let's say, Alzheimer, is not yet available for these people. It is supposed to be talked again in March 17th of 2023, so next year. Another point, excuse me, because I can't see it right now. Okay, so the other criteria is you have to be presenting in advance and irreversible decline of capacity. And oops, the last but not least, experiencing constant and unbearable physical or psychological suffering. So these are the main criteria. We have to remember that now the criminal code sets 2 paths to eligibility for medical aid in dying. The first one is for people that whose natural death is reasonably foreseeable. And when we say that, we can say that they have a vital prognosis is less than 18 months. So it doesn't have to be only 1 month or 3 months, but it's actually a year and a half. So it's foreseeable. The other path is for a person whose natural death is not reasonably foreseeable. But the difference that happens is that they still have access. The only thing is that in between the moment that they actually sign the papers, they have to wait 90 days before they actually receive the care. So there's a 90 days of waiting, but they can still, access it. I just want to be sure that everything's going fine. Okay. This. So what's important is, of course, that the patient may ask at any time a health professional for information about medical aid in dying. So it is not legal for us, for any medical the health professionals to say, oh no, it's not time to talk about this. You're not there yet. We're not going to talk about the information. So we have and we must give the information to the patient. If we don't have the information, we have to refer them. If we're not comfortable as a health professional, we have to at least, refer them to someone that can. So that is really important, that everybody has the right to know. And afterwards, the person can decide whether or not to make a formal request. So that request will be done by the person themselves. So it has to be in a free and informed manner. So they have to have all information before taking the decision, and they're free, and it is not influenced by anybody around either. What we are going to use, like I say again, is the prescribed form. So it's just a form. It's one sheet. It's very simple. It's just really asking for medical aid in dying and signing it. If we go through more details here at the CHUM, but of course you can receive medical aid in dying anywhere, so in any hospital, but also you can have it at home. So if it is something that we desire at home, then we just need to ask for the team of the CLSC to ask for the medical aid in dying, and then we also get to meet the team that will be able to come to our house. So what I'm talking to you today is really what I do here at the CHUM, because my doctors are not allowed to go to anybody's house. So when somebody is asking me and I start the procedure to make the request with them, it's because they are planning on doing this at the hospital. So what I do for all legal parts, I'm going to make one appointment. So we've been talking about it now and then, they call me and they say, okay, I would like to do my formal request. And what I do is I say, okay, fine, we're going to make an appointment. We take our time. I sit down with them at first, and then they're going to see other people. And by the time we're done with the appointment, everything legal has been done, and the answer to yes or no that they are that they can receive the care, then they will know by the time they leave home. So my first part is I meet the family and the patient. Again, we're going to be talking about, I'm going to give out all information and answer all questions about the request itself, and then the process of the medical aid in dying at the CHUM, how we proceed. So when the person decides to go forward, then what we do is we are going to sign the form. It's going to be in the presence of the health professional, which is me. And then the form has to be countersigned by me and by an independent witness. That means that if family came with them, I cannot ask somebody from the family. It has to be really somebody that is working in the hospital but has no connection with the patient. Sometimes people will ask me if the patient cannot write because they're having a hard time with their writing hand. What can we do then? Then there's no problem with that. So we can always get a third person. So there's me, there's the first witness, and we can get a third person that will be able to sign in your how do you say that, for you. They sign for you. They again, as you will see, they have to be legal of age, so an adult and capable. They're going to be, they cannot be a member of my team. So there's a few people that works with me, the orthophonist, the psychologist. So it can't be somebody from my team. It has to be really somebody that I find in the corridor that I work with now and then, that they're completely independent. After that, of course, the person that is going to be signing for the person asking has to understand the nature of the request of what we're doing during that day. And also, we have to be sure that they don't believe or know that they could be a beneficiary under the will of that person. So again, very independent. I want to add also that sometimes I get questions on, okay, I can still sign, but what if I cannot say it with words? I have a hard time to speak. Is it possible for me to still ask, or should I, before I lose my voice and my speech, should I do it in advance? And that is not necessary. It's something that we write in the chart that we've been talking about it. So the words don't have to necessarily come from your mouth. You can write it down. If you can't write, there's always a way to understand what we are talking about. So that doesn't stop anyone from asking. So second person that will be meeting my patient is the doctor. So the first doctor that meets with them is the one that will be giving the care. And he will make his first evaluation. So it's the first evaluation, what we're trying to see if the patient is eligible for the medical aid in dying, and to see what is the nature that is pushing, what's the reason pushing him to ask, if it's really free of will and everything. So the meeting with the doctor is actually knowing that he will be the one giving the care eventually. After that, we have the last part of the legal request. We need to have another doctor, another expert, independent from the first doctor, which is usually the neurologist that is following my patient will be the one doing the second evaluation, because they know them so well and they are actually experts. So my doctors or the second doctor will not be the one giving the care. It's really just the first one. It's just their opinion, and to make sure that they just confirm that the patient is filling all the criteria for obtaining the MAID. So if we have talked about it, and I will, because I have to tell people, of course, as a professional health worker, that if they do ask for the medical aid in dying, I have to talk about the possibility of to become a donor at the same time. So if that person is interested, while we plan this appointment, I can also organize an appointment with the Transplant Quebec nurse, which you will see the next part of the conference with. So I organize it so that at the same time, at the same appointment, they can get all information in one go. Then the last part is, of course, the choice of the date. So people will say, well, I'm not ready to ask to make my request because I don't have the date yet. But that's two different, like, it's independent things. You don't have to have the date. Some people will tell me, I want to do my request. I would like to make it legal and to know that it's always possible eventually, and that it's done. And as I always say, the request that we make, that appointment, and with signing all those papers, it will remain valid as long as the person retains his aptitude. So the possibility to say it again, yes, this is what I want, and you know that they're their mind is all there. So it could be weeks before, months before, and also years before, because there is not a, you're not obliged to use it actually. So you're always free to change your mind. Always, that the person can withdraw their request at any time, and they can also just postpone the date. So they can call me and say, well, I think this date is really important for me. I think this is going to be the date. When we get to that date, you know what, I'm going to change my mind. There is absolutely no problem. And the person is in charge of their own decision. And so there's no how do we say that? Obligation to use it. Is there any question as I'm talking too much, maybe too fast? No? Okay. So now I'm going to explain to you how the course of a day for the MAID at the CHUM goes, but can happen probably in any hospital. So what we will receive, usually the patient will arrive with their loved ones in the morning of that day that has been chosen. Of course, it could be the night before. Not many people choose that because you don't necessarily want to spend your last night in a hospital, which is totally understandable. We have a new hospital, so we have brand new bedrooms, and they're all private rooms, of course. So that gives a little sentiment of home feeling. After that, we sit down and we review the whole course of the day. So what's been chosen as, let's say, desired rituals. Is there any music? Do they need somebody in particular? Like anything that we can do to make it more homey, more comfortable, then we will get involved at that moment. After that, there's the preparation. So the only medical thing that has to be done, of course, is the IV access, because the injections that will be given are through the veins. So we have to make sure that we have an IV access. It can be either small ones in the arms, or we go to the radiology, we make an appointment in advance, and we install what we call a PICC line, which is a long IV access. That's not very long. During that time, or before or after, we're going to be also, so when I say we, is because there is a nurse that is dedicated to the patient that day. She has no other patients. The doctor is there. I'm usually there for my patients because I like to be close to them, and because we have a relationship and everything. So we as a team, we kind of support the family and everybody. So we make sure that the family is really up to date and understands what's going to happen, how to prepare themselves and answer any questions. After that, I'll probably tell members of my team that know the patient, and if the patient is interested, of course, the attending physician, which is the neurologist, the psychologist, the spiritual advisor. We have everybody that has been close to this patient that might want to come and say hello, goodbye. They might come and have a visit beforehand. And after that, there's going to be the visit of the doctor. The first doctor that was met, the one that will be giving the care, will first come in the room and present, introduce himself to the family, answer questions, and make sure that everybody's okay, and that is still the plan on going through. Because, as I said before, there's no pressure. So if the person changes their mind, even that day, we just stop, and there's no rush or pressure. After all these visitors and everything, we let the family have a private moment to gather with their loved ones, and sometimes there's a bit of rituals and things like that. So we give them their moment, and as it was planned before with the doctor, there is a moment that is okay, and we check that with the patient. So it's time to the administration of the care. So of course, the doctor and the nurse that will assist him come back into the room when everybody is ready. And then they're going to install them, so they're going to prepare themselves to give the injections. So for your information, this is the 3 injections that are going to be given is, first of all, it's all things that we use in ICU or operation room. So the first thing that we use is Versed, which is like a benzodiazepine sedative and takes away all anxiety. So the person really falls into a deep sleep. Then the second injection is propofol, which induces a sort of a coma and will slow down the body. And the last injection is the one that is fatal, so that will stop the heart. So these are the 3 injections that are given one after the other. There's not a lot of time in between, and so the person falls asleep, and you know, it's not something that we don't look at the patient slowly go. It's really just it's quite quick. So that's what we have to prepare the family and the loved ones for. For him, it's of course a very big sleep. Of course, the care team remains available for the family members if it's in or outside of the room, just in case. So after the medical aid in dying, of course, the doctor will leave, the nurse will leave, the care team make sure that we offer support to the family, somebody if they want some. We answer questions, requests, and we let the family gather in the bedroom for as long as they want. So that's quite fast, but that's it. I also I have a small video. Unfortunately, it's in French. I did some research. I didn't find it in English. I don't know, Kate, do you think I should show it in French or? Yeah, okay. So, so this is to make a bit of a bridge in between my presentation and the one from Lisanne, because after this, we're talking about the fact that we can also make organ donation after medical aid in dying. So I just wanted you to see one of the patients that has done that in the past. And also, there's one thing I think I forgot to tell you. If you're at the hospital, there is the organ donation that's possible, but also if for research, if somebody wants to really be part of research, there can be also a donation of the brain to make more and to try and advance the research on ALS. So I'm just going to make this small video and I come back to you. Tell me if it works. Oh, no, that doesn't work. What have I done? What did I do last time? Okay.
C'est la dernière journée de vie de Marcel Boucher. Demain, il mettra fin à plusieurs mois de souffrance. Une décision qu'il a prise pour lui.
Toutes maintenant mes difficiles afin que ce soit partir, respirer, dormir.
Mais pour partir en toute quiétude, il a aussi voulu penser aux autres. L'homme de 59 ans sera le 11e Québécois à faire un don d'organes après avoir reçu l'aide médicale à mourir.
Moi, je vois ça comme un message d'espoir. Parce que pour moi, le fait de donner mes organes, ça ne veut pas dire que je renonce à la vie. Au contraire, je vais aider des gens à poursuivre leur but. Le cadeau de vie, c'est un commencement nouveau pour quelqu'un d'autre.
Marcel Boucher pourra donner ses 2 reins et son foie. Les 3 organes ont déjà trouvé preneur.
C'est beau de dire, ah, je fais un don d'organes, mais c'est là qu'on veut dire, oui, on a quelqu'un pour, oui, tu es compatible. La sensation que ça fait en dedans, ah, merveilleux.
En juillet.
So this was the last part. I would like to know if anybody has questions, please feel free.
Does anybody have a question or comment that they'd like to share with Sophie before we continue with the second part about the organ donation? Looks like we're good.
Well, thank you very much, and I'll let you with Lisa now. Thank you.
So hello, thank you for having me here today to talk about organ donation after MAID. I'm happy to be with you. So like Sophie said, be assured that I can answer your question at all time. Don't be shy. I will answer on the spot, okay? So Transplant Québec, it's an organization that is that have its mandate by the Ministère de la Santé, and that promotes pro-donation, pro-transplantation values among the general public, like you, and among the health professionals. So we're here to coordinate the process from the beginning till the transplantation. Okay, so we're here to help everybody understand how it is important to know the criteria about organ donation, first of all. And we're here to help improve clinical practice in like the CHUM. And we manage the unique list of the people waiting for a transplant, and by that way ensure that organs are allocated fairly on the ethical and clinical criteria. So today I would like to demystify organ donation after MAID with you. And for that, I want you to know the specifics related to that donation, and help you take a well-informed decision for yourself and your families and loved ones. So what about organ donation? Last year, at December 31st, we got 144 donors along the year. And the patients that are still on waiting list, it's preoccupied because we got pretty much more patients waiting than patients who offer organs. So that's why it's important to know the process about organ donation. Know that 34 people die on the waiting list without any offer of organ before dying, okay? Who are the people on the waiting list? Most of the people are waiting for kidneys. What is good with that is that dialysis treatment exists for that kind of people. They can live a good life, but they are diminished by their current condition. But after, know that after 10 years of that kind of treatment, the life expectancy diminished to 50%. So we got a great need of kidneys, you know, and other organs that are needed are liver, heart, lungs, and other kind of organs. What about around the world? If we talk more specifically about MAID, organ donation after MAID, know that only 4 countries do that kind of procedure. The Canada are one of them, and we're the only one in the North America. So we're really pioneer in that kind of processes. So what you need to know before we talk more specifically about organ donation is that Transplant Québec is completely dissociated from the processing of the MAID. So like Sophie told you before, you see 2 doctors who accept your demand, but it's just after that Transplant Québec can go speak with you, okay? And it doesn't affect your MAID demand, okay? It's really it's both sideways, okay? And I'm not sure if Sophie told you in her presentation, but when you decide to have MAID, you can choose to don't tell your loved ones about that procedure if you want. So you can pretend to die in your sleep or something like that, and never told your loved ones that you have made a request for MAID. But if you want to do organ donation after MAID, you have to tell your loved ones, because if after you died, your loved ones want to see you, they're gonna see that they're done some procedure through your corpse, and they will ask why. So we cannot assure that the MAID remain confidential. So that's why you have to tell them. They don't have to be okay with it, because that's your decision, but they have to know. Okay, so like I said, when Sophie called me, she told me, okay, I've got someone who is eligible for MAID, and they want to know more about organ donation. That's only when I'm gonna speak with you and your loved ones, okay? Only then. Usually, we're doing that kind of meeting in the same day. So you come tomorrow, the morning, you see 2 doctors with Sophie, and if you want to know more about organ donation, I'll jump in, okay? And I'll tell you all about the specifics of organ donation after MAID. So what is important to know is that if you agree to organ donation, we're gonna have to review your medical files to see what happens before. It kind of helps us to know how well is your organ. We're gonna have to have a medical social history questionnaire with you. It's pretty much the same questionnaire that they do on EMA Quebec when you're going to give blood. It's about your history, okay, your past history, your travel, things like that, okay? And we also got to do blood tests. We got pretty much big number of tubes that we're gonna take to see how your organs are functioning, and to see to the compatibility with the patient on the waiting list, okay? We're gonna do COVID testing too, and we're gonna do a scan or echography, okay? All of that stuff have to be made before the MAID process. So 7 days till 48 hours before the MAID, it's the range that we got to check that, because we need these information to check their waiting list and to see if there's someone who needs the organ that you offer, okay? That's only why. So you have to go to the hospital before your MAID administration, okay? That's really important to understand. We cannot do that kind of stuff at your home, okay? You can choose to stay at the hospital after that if you want to, but like Sophie just said, it's pretty rare, that kind of decision. But if you want, you can. Know that the consent can be withdrawn at any time. Like the MAID procedure, organ donation is the same thing. If you don't want to do with it after a certain amount of time, it's okay with us, okay? Sophie told you about the 3 injection for the MAID to go on. Know that if you go with the organ donation, we're gonna add 1 syringe before the MAID occur. This syringe is of heparin. Heparin is like aspirin, but pretty much more than aspirin. It's to make sure that you got no clot in your blood and your organs after the MAID donation. You also have to know that the confidentiality of the identity of the potential recipient is really important for us. So during the process, we we're gonna tell you and your loved ones how it's going, if your liver is accepted for someone or your lungs, but you will never know to whom they're gonna go, okay? And know also that the last evaluation is done in the OR, okay? So because the transplant team cannot know for sure that, for example, your liver is good, they will know for sure only when they see with their eyes, okay? So there's always a possibility that under OR, we tell you, okay, no, we cannot take the liver. Also know that you can have an end-of-life ritual, like with Sophie. Just some things that are different is that if you're going to do the procedure directly on the OR room, you cannot bring flowers or something to eat, stuff like that. But we tell you all along the way what you can and cannot do. But we try to respect what you wishes, okay? Important thing to know too is that there is limited time granted to the family with the person receiving MAID following the attestation of the death, because the death must be more clinical, more medical than just with the MAID process. Because after that, you're gonna go to the OR room. We wanna make sure that there's no activity in your heart. That's only why we limited the time. What can affect or prevent organ donation? It's simple. You can change your decision about MAID. You can lose your capacity to consent. There's some discussion with the government about that. Maybe it will change someday, but for now, if you're not 100% here mentally, you cannot have MAID, so you cannot have organ donation too. You may wish to receive palliative sedation, like Sophie told you. In that case, we cannot take your organ. You may wish to die at home, because like I said, we have to be at an hospital, any hospital at all, if there is an OR at that hospital, okay? Because the organs must be transplanted really, really soon after the death of the person, okay? If you may not wish to inform your relatives, you cannot proceed with organ donation, like I said before. And if you withdraw your consent to organ donation, we tell you thank you, and you go with your MAID process like usual. The big day, like I said, you can have an end-of-life ritual like you want with your loved ones. After that, your MAID will be administered in a room near the OR or in the OR. It depends on what you feel more comfortable, okay? We go with you in that case. Know that I'll be here, or a colleague of mine and a coordinator of Transplant Québec too will be there. We respect your privacy, but we have to stay there to ensure that everything's going well for the organ donation process. After the medical aid in dying is administered by your doctor, he told your loved ones that he thinks that you're dead, and we have to wait another 5 minutes to be sure that everything's fine, that your heart has no activity at all. So we gotta check with usually it's with an echograph appareillage. Is that, you understand what I mean? Sorry for my English again. Just to make sure that there's no circulation, okay? That's it. And when the 5 minutes is done, we go right away to the OR room where we're gonna take the organs, okay? So sometimes it's difficult for your loved ones to have to withdraw so soon. So they're gonna know before, okay? After that, Sophie, me, we are staying with your loved ones to support them, to laugh with them, to remember you. As long as you need to, we'll be here with you, okay? After that, if your loved ones want to know how it went, the coordinator will make a phone call to them to inform them that the process is complete, to ensure their question, and of course to thank them for having accompanied you. And we, at that moment, we told them that for example, the liver is successfully transplanted and things like that, okay? If they want to know. 2 months after that, we sent a letter to your family to thank them again and to give them news of the organ recipient. It's confidential, like I said, you don't know who received, but how they go, okay? And we also send you an invitation to the ACDO. ACDO is the Association Canadienne de Dons d'Organes. And in the picture here, I put some picture of the epitaph where the name of the organ donor are here, okay? And once a year, it's got a celebration of the organ donor. It's a pretty cool celebration that we acknowledge your good heart and your generosity, and your loved ones can also receive a medal after that. And also 2 months after, I make a phone call to your loved ones to know how they do, to take their comments about the process, and if they need to, I can also give them some reference for if they have problem with the lost, okay? The most significant is that we respect for the person wishes at all time and no pressure. Like I said, you can always withdraw your consent at all time and there's no judgment on our part, okay? So it's your decision and it's the better one for you, okay? But know that the organ donation help save lives and help your families and loved ones to give meaning to events. And like you watch on the video that Sophie passed, the meanings for the patient is also so important, that to know that they don't go without giving nothing, okay? So I don't think I have, oh yeah, okay. I also don't find a really short video about organ donation after MAID, but I find a documentary that called Her Last Project. It's a really good one if you want to look at it, but it's 45 minutes. So here, I'm not a specialist about video training, but I give you here some info about this video, but it's in English. Better than mine, I hope so.
Il n'y a pas de son, Lisanne.
Un instant.
The hand I've been dealt.
Y a du son?
This isn't.
Ah, ça va bien, hein?
This isn't the way I want to die. I wanted to die when I was 80 in my bed quietly and just go to sleep at night. But that's not the hand I've been dealt. I'm not looking at MAID as just as a way to end my life. Yeah. To me, it's a way of ending my life at a time when I'm ready and how I want, not when someone else thinks I'm ready.
I became involved with this MAID process and met Shelley because of my involvement with the donation program. Shelley had expressed a wish to be an organ donor, and so we were contacted.
I've spent my life trying to help people. I could save, I don't know, 5, 6, 7 lives. It hurts for me to say no to that.
She still has the reassurance to know that when she's had enough, she can make a choice. It's maybe one of the few things that can't be taken away from her now. She can still choose when she's done.
I don't feel like I'm living anymore. I'm just existing. And that is not how I want to be.
So that's the end of it for me. So I'll be happy to answer if you got some question.
Thank you very much, Lisanne. Does anybody have any questions for Lisanne or for Sophie? Any comments? Was this informative? Thank you, Sarah. Thank you for that. It was very informative. Thank you. We are such a small group, so I'm kind of addressing everybody. Mrs. Rowe,
There we go. I finally got it. It was very good. Thank you. I appreciate understanding everything.
Thank you.
Thank you.
Welcome.
Thank you very much then, everybody, for your presence. We're not going to keep you longer than this. Thank you once again, Lisanne and Sophie. It was so wonderful, very informative. We will be putting up the conferences on our website, so people will be able to view it afterwards. Thank you for everybody who took time out this afternoon to be with us. Wonderful. Thank you, Jennifer. So have a lovely afternoon, everybody, and we shall see you next time.
Okay, thank you.
Thank you.